Hi, my name is Chris Keeling. I'm a dermatologist here in Edmonton, Alberta. I have a special interest in Hidradenitis Suppurativa. This is an inflammatory condition that causes chronic and devastating effects on its patients. Historically, it was known as a condition with a rare prevalence in society and was primarily an infectious disease problem. Over the last decade, we've come to understand that although there are a number of bacteria in these lesions, the disease is primarily an inflammatory one. And indeed, some of the anti-inflammatories we use are antibiotics, but for the latter benefits of anti-inflammatory. I'm here to open our eyes to the possibility that the consequences of this chronic inflammatory disease are surgical. My fellowship after dermatology was in surgical dermatology, and that led me to meet with Dr. Bill Danby, an expert in Hidradenitis Suppurativa. He enlightened me that the traditional ways of doing Hidradenitis Suppurativa surgery with a wide local excision have been leaving patients with disappointment. About half of the patients who had surgery that way would end up with a recurrence. He then showed me the de-roofing and debridement procedure, where patients were frozen locally under local anesthetic and then had the roof of their draining plaque removed surgically. This then allowed access to the core where all of the inflammatory milieu was, which could be scraped out and allowed to heal secondarily. With good management with wound care, these patients heal up relatively quickly, and we've been finding significantly lower recurrence rates. For a condition that affects so many more people than I ever imagined, and in a way that no one really talks about, this has been a real boom to my practice. Most patients find it difficult to talk about this condition because many of their lesions are in private areas. This leads to smelling, which makes intimacy difficult. Nobody outside of the population of hidradenitis seems to understand the pain that comes with this condition when their lesions are acute, coming up quickly, or even when they're chronic, eliminating their range of motion. We've adapted a more holistic approach to our patients where we ask them to reduce the amount that they smoke and the amount of dairy they intake, supplementing with vitamin D, calcium, and zinc to augment the deficiencies that they have without the dairy. We do introduce anti-inflammatories, often an antibiotic, and perhaps go outside of the usual anti-inflammatory approach with some hormonal or even some uncommon antibiotics that have been used historically. A new medicine, adalimumab, has really opened up the area of Hidradenitis Suppurativa research, and we are grateful to the AbbVie company for all they've done for us surgeons, medical dermatologists, and patients with Hidradenitis Suppurativa. I'd finally like to say that this inflammatory condition has consequences, and those consequences are chronic, draining, weeping wounds with fistulae and sinuses that give patients a great deal of discomfort, physically and emotionally. And the process of de-roofing and secondary intention healing leads to patients with hope and optimism that the condition they've suffered from for many decades can be managed satisfactorily. Thank you.